in the current state of women's health in Canada right now, but actually for decades, women's health is overlooked and underserved. And what many of the women tell us with the Women's Health Coalition is that they go to the doctor and they're told it's normal. That is the most common answer to every single symptom a woman is experiencing. They will ask her how old she is, and then they will say, oh, well, that's perimenopause, that's menopause, that's puberty, that is whatever the age and stage that is the norm, automatically elicits a response from the healthcare field that this must be what it is. But again, it's not based on data. It's based on what they know best, what they hear most, and what they can bill for. And that's one of the things in the current health system that is a huge barrier. When doctors, when general practitioners, family doctors are not compensated for a thorough women's wellness check, they're not going to take the time that's necessary to drill down on the experiences that the woman is having, the lived experiences.
Some stats that I find fascinating are that 80% of osteoporosis cases are in women. 80% of autoimmune diseases are in women. In 78% of cases out there that women have heart attacks, they're not being recognized. And the why is because they're showing up, the symptoms are showing up different in women versus men. That's at the system level, but it's also at the individual level. Women aren't aware of this either, right?
We can't ignore the fact that women live longer than men, up to 10 years longer than men naturally, but in that extra 10 years, they are going to live much less well, much less, with a much lesser quality of life, probably in some sort of assisted living. The number one reason that women go into assisted care is because they can't take care of their daily needs, like toileting and that kind of thing. And that's all preventable. And it has to start with the women themselves. And then the system needs to be responsive to their needs in a more intentional way based on the various ages and stages that they're going through, not this cookie cutter approach that we have right now. Because it's either cookie cutter or it's not there. Why? Why in this day and age are we saying that people can't own their own information and that to release it, somebody of higher authority needs to give permission?
Well, I think it goes back to the whole silo approach that we've had in healthcare, right? That's how we've been trained as healthcare professionals. That's how we execute care. Nobody's talking to the other. And we've talked about it for years and everybody knows it's a problem. But the issue is that we're not breaking down the silos. As the CEO of Philips said at a conference a couple of years ago, none of us want to use 50 different apps. We want one. And so the only way that all of these great singular ideas to solve a problem for women's health are going to be successful is if everybody agrees to collaboratively work together and bring it under one roof so that women there's not so many barriers to entry and engagement. We're a group of healthcare professionals that decided that we saw a massive problem in the clinic setting of a lack of resources to give patients to manage their health at home, and realized that technology could actually help us solve that problem and be a conduit of care between the healthcare professionals and the patients, and really giving the patients a system that they can manage their health at home, but they can actually build self-efficacy, build that self-confidence to actually be that advocate. 28 years that I've been a healthcare provider and seeing what women go through with navigating health and navigating the system and understanding that yes, the system plays a role, but I've always focused on what can we as individuals do, because the system takes decades to change. It's a very slow moving machine, and for a reason. I get that. I'm not criticizing it, but the reality is patients are coming into clinic to see me every single day, and I have to help them solve a problem today.
Yeah.
So if the problem needs to be solved today and the system can't do it, then who's going to do it, right? And so that's how I've always looked at health is, well, we can't give up. We can't just accept that this is what it is and tell people, oh, in 10 years, maybe we'll solve your problem. No, we have to figure that out now.
There are a lot of predatory practices out there. There's a lot of apps out there where the data is being exchanged, without being compliant with privacy laws, right, where the cost for the products that are being promoted in that app are prohibitive, but women are desperate, so they're buying them anyways. I guess one of my aims is to make sure that the Women's Health Coalition can send people to reliable sources.
There are thousands of tech programs being built for women's health, and they're all problem solving one piece. So I'm not going to name names, but there are two menstrual tracking apps. One of the biggest ones in the world has undergone 2 lawsuits because of breaches in data or selling data. And women need to be aware of this. And another shocking stat to me was less than 20% of the apps that are on the market today for women's health are SOC 2 Type 2 compliant. That is the gold standard for privacy security measures, but 20% for women's health. So I feel, to your point, that it is a predatory world out there. And are we really, is the entire ecosystem really looking at it from an equitable perspective, from a true, we are trying to solve a problem that is actually going to improve women's health? Are we looking at it through those lenses? And I'm not convinced we are.
I was looking for something that truly would empower women with knowledge and data and ownership of their health experience. After careful consideration and talking to our clinical expert team, we just really felt that My Viva would be an option, and then chose to start working with you. This is a sales pitch for women to take control of how they feel, how it's self-care, it's self-management, it's self-awareness. Every single chronic disease organization has a book on self-management or dozens of books on self-management. Okay, so move from a book to an app. This is self-management, this is self-care, this is self-responsibility. Again, I'm going to go back to My Viva as a technology. We knew that there were people that needed technology. They wanted stuff on their phone. They want the constant input and the interaction. And, there's some great resources and fun resources that are very digitally friendly. And then we know that there are people that want more of the two-dimensional type information. And the Women's Health Coalition has that on our site. And My Viva has brought that to life in women's health. You've created, this credible resource of information, and you've turned it into an absorbable digital platform for people that, want it in that space.
And that's why I call it very serendipitous, this relationship, because it's the same vision.
I'm going to go back to My Viva and the whole concept of self-care. You can say I'm tired, or you can say, I only slept 2 hours last night. The rest of the time I was looking at the clock. You can say I tried meditation and I'm still not able to get back to sleep. You can say I took melatonin and I still didn't sleep.
Exactly.
Well, that kind of insomnia means something different. And then if simultaneously you're taking your temperature in the morning because you're trying to have a baby and you put all this stuff together, that's when you get the whole picture. But not all of it has to be addressed by the doctor. It could be you start to see a pattern where you had your regular glass of wine with dinner, and maybe wine isn't your friend. It might make you feel good and it tastes awesome, but it might not be the thing you should be having, or it might actually be helping you sleep because those nights you didn't have it, you didn't sleep. That doesn't mean alcohol should be a sedative, but if it helps to relax you, maybe that's not a bad thing, and that's something you need to talk to a dietitian about, somebody who really understands nutrition.
It starts with the self-awareness. Being able to think about what we all do with self-care and what self-care looks like for me and for you are going to be two different things. And that's okay. but we need the tools to understand how our behaviors are affecting how we feel physically and mentally. And Dr. Albert Bandura proved this back at Stanford in the 1970s, that if we start collecting data about how we're behaving, we will naturally connect the dots on how that behavior is affecting us. And then we'll start to slowly shift in how we're behaving. And that is what helps us build those sustainable habits long term and helps us manage our mental and our physical health. So we have to look at self-care as being the foundation. And when we look at that, then you cannot, within the health system, when women are coming to healthcare professionals and saying, look, here is my data, here is what I'm learning, you then cannot get dismissed because you've actually got the data to actually say, okay, well, here is my self-care. Here is what I'm actually doing. Now, you can't actually just say that it's because, I'm not looking after myself. I actually am looking after myself. I'm still having these symptoms. Help me figure it out. It's about being that advocate and making sure that you have your data to actually go and have the conversation and then advocating to get the answers and not settling for anything until you do. It's amazing to find organizations like the WHC that have the same vision as the team at My Viva. We are a group of passionate healthcare professionals that we want to help people take control of their health and live an as optimal a life that they possibly can, both physically and mentally. That, in my opinion, is what every human on this planet deserves. And women have historically had a tendency to just put our health, our desires, our passions aside for others, right? We're the caregivers. It's time that we take that back. And I don't say that in a sexist, negative way against men at all. I say that in a way to just embrace us.
I think this is the next feminist movement. I haven't figured out what bra I need to burn to bring women's health to the forefront, but there's something. It really is a revolution in women's health because we got the vote just over 100 years ago, but some of the systems that we're still using in health for women date back to that time. And so it is time for another revolution in women's health equity. So take out the word health, but women need to do another rising. And so I don't know what the bra is going to look like that we're going to burn, but I'm going to come up with something symbolic that says, now's the time.